Hello, I'm James Maskell, and I am the founder of the Evolution of Medicine. We empower doctors and other health professionals to deliver community-focused medicine focused on prevention and root cause resolution of symptoms. Whether it be at our functional forum or at many of the doctor conferences that I go to every year, the core frustration that I hear from doctors is that it's harder and harder than ever to make it in private practice. Examples of this are the cost of paperwork for billing Obamacare, reimbursements going down, costs going up. Now this would be a tricky proposition for any entrepreneur, but what about for a doctor with thousands of hours of clinical experience, but not even 100 hours of business training? 3 years ago, at the first conference that I ever spoke at, I met 3 doctors and they told me exactly the same story. They had sold their practice to solve all of these problems to a hospital system. Unfortunately, within a few months, the hospital had decided to fire them because they weren't sending enough leads to the other specialists within the system. It made me sick to my stomach that great doctors were being shackled by the system, and I vowed to do something about it. In the words of Bucky Fuller, you don't change something by fighting the existing reality. To change something, build a new model that makes the old model obsolete. So what is this new model that we're speaking of? There is a dramatic increase in the interest in functional and integrative medicine, so much so that major medical organizations like the Cleveland Clinic are betting on functional medicine for the future of chronic disease management. At the same time, we have a quantified self-revolution with wearables and smartwatches, making it easy for the general public to track their symptoms, to track their information, and to understand root cause resolution. And that's why we have a once-in-a-generation opportunity to build a new model that makes the old model obsolete. But in order to change everything, we need everyone. And that's why I started the Evolution of Medicine community, to give back to those practitioners and doctors leading this medical evolution. We share with them best practices and existing models to be able to help them to build strong, sustainable, community-focused integrative medicine practices. If this sounds like something you'd like to be part of, I've created a special video for you called The Simple Prescription for a Thriving Practice, which will give you starting points for you to create your own remarkable practice vision. Simply click on the link below to get instant access. Thank you so much for watching, and I look forward to connecting with you soon.